Melina Rivers, RN with BrightStar Care of Charlottesville, and I'm going to talk to you a little bit today about a serious topic, caregiver strain. So oftentimes in healthcare, we talk a lot about what it is to care for our patient or the person receiving care. They're not always a patient, sometimes they're a client. But we talk a lot about that person and their needs and how we can fulfill all of those needs. Oftentimes, we overlook the needs of the persons that are caring for those people in the home. The daughter, the husband, the wife, whomever that person might be, they are working very hard, all hours of the day and night, every day of the week. And they still have a life and needs that need to be met. When we don't make sure that those needs are met and that we're taking care of them, we end up creating a very volatile, potentially dangerous situation for them. We all know that getting frustrated can cause us to lash out in sometimes emotional and or physical ways. So if we're not making sure that our caregiver is getting the appropriate breaks that they need and getting those breaks frequently enough, we can open ourselves up into liable situations where not only are they frustrated, but they may take acts that they will certainly regret. There are a lot of other family members and friends that could help out, and we need to make sure that we're advocating for our caregiver to ask those people for help. Call your brother, he can help too. Make sure that your primary caregiver is getting what we call a respite, a break. The average caregiver caring for your average dementia patient works about 102 hours a week. This is statistically proven. 102 hours a week. Now we might feel like we're working all the time, but very rarely are any of us working 102 hours a week. When we think about that, these people oftentimes have children, they have spouses, and sometimes even have jobs. Add all of that together, what's going to be for dinner? Did mom get her medication? Did the dog get to the vet? This is a lot of work. Advocate for yourself, reach out to community resources. There are tons out there, many of them are free. Agencies like BrightStar can offer you a low-cost, temporary option to just get even a few days of respite so you can take a vacation. Caregiver strain is real. We need to make sure that we're taking care of the people who are taking care of our people. If you want to find out how BrightStar can help you, connect you with community resources, or be a great resource for you, give us a call or look for us online.